hospitals has been discussed under the topic organizational structure. So levels allow efficient management of hospital department. That is, if we provide a structure, there is a proper structure, there will be a proper functioning of it. So just for its simplicity, every hospitals should have their organizational structures. So the structure helps one understand the hospital's chain of command. That is, the organizational structure, it can be varied from hospital to hospital. Large hospitals have a complex organizational structure. Why? Because in case of large hospitals, there will be, as I said earlier, the number of staff in a large hospitals will be much more high. So it forms a complex organizational structure. But in case of a simple hospitals, that is like primary, secondary cases and all, the organizational structures will be somewhat simpler. So next this is how a structure of an organizational structure of an hospitals. That is, there should be a board. That is, a board should be there. The board, mainly it will be the persons who have established that hospitals. So it is from this board that official decisions will be making. Then under that, the administration department, that is administration department, we are coming to see in the next slide. Then administration. So administration, after that there should be an information services, therapeutic services, diagnostic services and supportive services. So this is an overall organizational structure. So if it is asked, this flow chart will help you to understand much more regarding the organization. So there should be an organizational board should be there. Under that board there should be a proper administration, and it should be under the all these services should also be provided by the hospital. So first it is regarding the administrative services. So hospital administrators will be the CEO, Vice President, Executive Assistant and Department Heads will be the administrative persons. Basically they will be handling a business to run the hospitals, and they also see the budgeting as well as the finance, establish hospital policies and procedures. There are several hospital policies and procedures we will be discussing in the coming lectures. Then it also provides public relation duties also. So this is all about the administrative services. Next is informational services. That is basically mainly it depends on the document and process information. That includes admissions. All the details regarding the admissions will be coming under the informational services, billing and collection, medical records. The medical records of the patients will be also administered by this informational services. Computer information systems, health educations, human resources, etc. comes under informational services. Next is a major service that has to be provided by a hospital is therapeutic services. So it provides treatment to patients, which includes following departments. So basically it provides the treatments to the patient under several departments. So first one is dietary, that is maintain the nutritionally sound diets for the patients. So dietitians in nowadays in super specialty hospitals and all will be having a dietitian. The duty of a dietitian is to provide much information regarding the food items, if there is food interactions, food drug interactions, or diet control chart, especially in case of diabetes patients and all. This dietitians will be providing several plans for those patients, that is keto diet, example is keto diet. So such diet will be provided to the patients, and the patient has to follow those diet, and their major role is at the time of discharge. When there is a discharge of patients, the dietitians should counsel the patients regarding the diet chart. Then is sports medicine that provide rehabilitative service to the athletes. So if athletes are facing any difficulties, they should consult with the sports medicine. Then nursing, it's provide care for patients. So nursing is one of the major area where in all departments this nursing services have been provided. Respiratory therapy that treat patients with heart and lung disease. Medical psychology concerned with mental well-being of the patients. Social services, that is connects patients with community resources like financial aid. So if the patients are standing financial backward, some aid programs will be there in the hospital. So all those informations will also be given by the social service departments. Then the other services like pharmacy, where we plays a major role, that is as a pharmacist we have to dispense the medications. So pharmacy is a place where we have to dispense the medications. Then physical therapy, that is treatment to improve large muscle mobility, that is all the that is ability to walk, ability to run. So all this has been provided by the physical therapy department. Then occupational therapy, treatment goal is to help patient regain fine motor skill, that is whether that is their motor impulses is being activated by using these therapies. That is, if they have ability to take something, some patients especially those who have bedridden and all, the occupational therapy will be given. Then speech or language pathology department, that is identify, evaluate, treat speech or language disorders. Mainly in case of children's, the speech therapy, as the therapy will be there. If the children are not able to speak well, they will be under consultation with the speech therapy. They will provide several training programs for those children for just for speaking purpose. Then diagnostic services, it determines the cause of illness or injury, which mainly includes a medical laboratory, that is studies of the body tissues. Basically the blood test, blood samples taken, all those comes under the medical laboratory. Not only the blood, it is urine, every body tissues will be examined in the medical laboratory. Then medical imaging, which will be familiar to like radiology, MRI, CT scan, ultrasound scan, all those things comes under the medical imaging. And emergency medicine provides emergency diagnosis and treatment. So in case of poisons and all, an immediate action has to be taken, or if there is a stroke patient, an immediate action. So we should be much more emergency team will be provided in such hospitals for this emergency situations. Next is supportive services. It provides supports for the entire hospitals, that is both the control and coordination of the hospitals, that is stocking, supplying, all these processes will be enhanced under the support services. So central supply orders, receives, stocks and distributes equipment and supplies. Then biomedical technology, that is design, build, repair medical equipment. So if there is any repair in the medical equipments and all, it will be consulted under biomedical technology department. Then housekeeping and maintenance, maintain safe and clean environment, that is some like cleaning the floors, maintaining a clean environment in the hospital is maintained by this housekeeping and maintenance department. Next we have to discuss regarding the medical staffs. Which are the medical staff? Medical staff, I have already told you, medical staff should be there in a hospital. So how can we define the medical staff? So medical staff is composed of a licensed physician. Of course doctors will be there, and it also include the licensed professionals who are permitted to provide patient care services in the hospital. So licensed, of course doctors should be there. Then there should be the licensed professional like nurses, pharmacist, clinical pharmacist, therapist, that is speech therapist, dietitians. All these persons include under the medical staffs, because all these persons provide patient care services. The medical staff has the overall responsibility for the quality of professional services provided to patient by those with clinical privileges. The chief of medical staff is the elected representative of the medical staff. The chief of staff appoints all of the committees other than the executive committee, whose members are elected by the staff or appointed by the board administrator. So the functions of the medical staff include to advise the governing body on medical affairs, to accept accountability for the quality of care rendered to patients in the hospital. That is, basically we have to provide quality care treatments, to request, review and act upon reports of medical staff committees, to scrutinize the professional ethics of its member and to initiate corrective actions as indicated. to develop, implement and review medical staff policies. So all the staffs, I have told you chief staff will be appointed. That chief staff will be enhancing all these functions. Then it again includes recommend action to the administrator on all medical administrative matters to ensure that the hospital has been following as per the basic guideline for standards of care. One of such guideline is Canadian Council on Healthcare Facility Accreditation. So whatever is the accreditation of the hospital, based on that only the hospital is functioning or the medical staff is going on. This has to be looked after by a chief medical staff. As an overall, what all points we have discussed right now will be coming under the functions of hospital. So in nutshell, we can see the main functions of the hospital is prevention of disease and promotion of health, medical and nursing research, medical education and training programs should be given, outpatient services, OPDs, diagnostic and treatment of diseases and patient care. So that's all about today's lecture. Thank you.